So, like, are we going shopping this weekend?
Yeah, because I have to. I don't have any.
We need to find something.
Oh my god. What is going on?
Oh, man, Soly! Oh my god. Why am I on the floor?
You just had a seizure? Did you not know? Like,
I'm messing around. I did not.
yes, you did. Show her the video. She doesn't believe it.
Look, Soly. Witchcraft. I'm possessed.
Well, maybe we need to take you to the doctor before you start making crazy assumptions. Let's go.
I'm not capable to go on. My soul has been abducted by aliens, and you just witnessed them entering my body as they are proceeding their plan of morphing my body into whatever they please in order to take over our planet. Y'all are not safe.
Stop being dramatic with your Uranus comments. Let's go.
Okay.
You will be impressed with the vocabulary I'll be using. I keep practicing. Just watch.
I'm sure I'll be entertained by this catastrophic conversation.
Hi, Dr. Susan. At the moment, the left side of my body feels numb, as if I'm a victim of paralysis, loss of oxygen, no control of the release of my urine, and my elbow, which is distal to the shoulder and proximal to the wrist, to be exact, is kind of sore for some weird reason.
Well, it sounds to me like you're suffering from hemiparesis, and my diagnosis is that you went through dyspnea, semi-conscious, and catalepsia.
Correct.
Have you been diagnosed with these symptoms before?
I don't recall, but my mom informed me that this hasn't been the first time I've had a seizure.
It seems to me like you have epilepsy, but to be sure, let me run some physical and neurological examinations and check to see if you have kidney disease. This is common for epileptic patients before it gets worse. In the meantime, I'll inform you on the possible treatments for the disease.
Okay. All right.
If these drugs do not succeed, surgery such as an anterior temporal lobectomy or temporal lobe resection may be performed to significantly reduce the occurrence of seizures.
Surgery?
The anterior and the medial parts of the brain are the ones that are most affected.
What kind of incisions are going to be made?
A coronal cut would be more beneficial in this operation rather than a sagittal or transverse cut. It requires an incision superior to the ear, which are lateral to the skull. Next, during the craniotomy, another incision will be made with the help of a high-speed drill through a protective membrane, the dura, which is deep to the skull but superficial to the actual brain. Surgical microscopes will help aid the surgeons to give them a magnifying view of a certain area.
Let me help you in the chair. Sounds pretty cool. I can't wait to go back to school and talk to my counselor to change my classes.
Sounds fantastic. But for now, let me get you home, and I'll contact you as soon as I get the test results in.
Hey Soly, how are you? What can I help you with today?
Well, I went to the hospital and I think I want to major something in the medical field.
Well, if you're interested in being an anesthesiologist, veterinarian, pharmacist, physical therapist, occupational therapist, orthodontist, emergency medical technician, chiropractic, or any other career along with those lines, I suggest you take the course Anatomy and Physiology.
What's anatomy and physiology? Like, what's the difference?
Anatomy is the study of the structure and the shape of the body and its parts, while physiology is the study of how the body and its parts work or function.
I guess that makes sense. Well, that class seems pretty interesting. I'll take it.
Okay, just follow the schedule on Monday, and you'll be set.
Awesome.